Please like and subscribe for more interesting topics.
How the digestive system works after gallbladder removal surgery. In human body, the gallbladder is about 4 inches long, pear-shaped and green in color. It is located under the liver and on the right side of the abdomen. The biliary tract connects it to the liver and the duodenum. The liver produces bile, a yellow-brown digestive enzyme, which travels down the common hepatic duct into the gallbladder. The gallbladder will store and concentrate bile while it's not being used for digestion. When food enters the mouth, it will pass through the esophagus into the stomach. It will be dissolved in the stomach and the hormones will alert the pancreas, liver and gallbladder to produce digestive juices and transfer bile in preparation for the next step. After about 3 hours in the stomach, the dissolved food will move into the small intestine. At this time, the liver will send the bile to the gallbladder, which secretes it to the first portion of the small intestine called duodenum. The bile helps the digestive process in the small intestine by breaking up fats. Then it will move towards the jejunum and ileum for maximum absorption of enzymes and molecules into the bloodstreams to feed the organs and the tissues. The leftover fiber, water and dead cells that are separated during digestion goes into the colon and turns into stool and expels it as a waste. Although gallbladder has a purpose, we don't really need it. Once the gallbladder is removed, the bile will be rerouted by the liver directly to the small intestines. Normal digestion is possible without a gallbladder. Bile will continue to reach your small intestine, but it just won't be stored along the way. This may stimulate the intestine and 50% of patients may experience loose motion. This symptom will usually last for only 3 to 6 months. After that, patients will return to their normal status. Therefore, changes to your diet is necessary. There's no standard diet to follow after gallbladder removal surgery. In general, it's best to avoid fatty, greasy, processed, and sugary foods. Eating these foods after having your gallbladder removed won't cause serious health problems, but it can lead to a lot of painful gas, bloating, and diarrhea. The good news is that the healthy diet changes after gallbladder surgery encourages you to lead a healthier lifestyle and in fact will increase your lifespan. Especially for the first 3 to 6 months after the gallbladder removal, you should limit your fat intake. Your body will have problems digesting fat right after surgery. The less fat you eat, the better. As you recover, you can gradually add more fat into your diet. Choose leaner meats or plant proteins. If you're used to eating a lot of meat, a gallbladder removal diet can seem intimidating. But you don't have to cut out all meat. Just opt for leaner meats or plant proteins. Avoid processed food. Processed foods often contain a lot of additional fat and sugar. This makes them last longer, hard to digest and don't offer much nutrition. Choose boiled or steamed food over fried. Fried foods have a high fat content and are hard on most people's digestive systems. The ability to digest and process fats has been compromised due to the fact that bile is no longer being stored in the gallbladder. Limit dairy products. While it's best to simply avoid dairy products altogether, it's best to stick to low-fat or fat-free dairy options. High-fat dairy products can cause diarrhea and painful gas or cramping post-gallbladder removal surgery. Reduce the amount of fiber intake. In the first few months after surgery, eating foods high in fiber causes bloating, pain and diarrhea. Reduce your caffeine intake. Caffeine contains acids that can cause your stomach to make more acid and drain faster. This can lead to stomach pain, more gas, bloating and discomfort after having gallbladder removed. Making some slight adjustments to your diet after having your gallbladder removed will go a long way in making your recovery smoother. In addition, you can also follow these tips. Don't start with solid foods right away after surgery. Slowly introduce solid foods back into your diet to prevent any digestive issues. Eat small frequent meals throughout the day. Having large amounts of food at once can cause gas and bloating, so split up your meals. Try eating 5 to 6 small meals a day that are a few hours apart. Snack on nutrient-dense, low-fat, high-protein foods in between meals. Try not to eat more than 3 grams of fat in a single meal. Substitute basic ingredients in recipes. For example, use applesauce instead of butter when you bake, or make an egg substitute using flax seeds and water. Consider following a vegetarian diet. Meats and dairy, especially full-fat versions, are often harder to digest without a gallbladder. Stay fit. Slowly increase exercise, as keeping yourself at a healthy weight can help with digestion. Watch out any signs of infection at the incision site like redness, swelling, drainage of yellow or cloudy pus. If there is, check with your doctor immediately. Diabetic patients should keep their blood sugar levels under control to reduce the risk of slow-healing wound and complications. In summary, your body can still function well without your gallbladder. Introducing these healthy dietary habits into your lifestyle even after 3 to 6 months of surgery will benefit your overall health in the long run.